I'd like to talk about Williams syndrome. This is a genetic condition we see quite often. Fortunately, most of the kids we see uh, with Williams syndrome do very well. That's not universal, but generally the kids are doing very well and sometimes extremely well. Some of the common characteristics relative to Williams syndrome kids is they physically have a look that is rather similar. It's been kind of called a pixie look. Uh, the kids are actually cute looking kids, and but they have a distinctive physical facial features. Uh, Common problems that we see physiologically with these kids are cardiac issues. We have and also have some hearing issues, and there's a variety of different hearing issues we may see. In terms of generally what's the perception of kids, with Williams syndrome, is that they have often language skills that are apparently higher than their cognitive skills. Uh, they tend to be very social kids. They tend to be great at remembering people and names and are very, very sociable and friendly. A lot of the kids have very good musical abilities, which is probably related to some of the auditory issues they have, or in some cases, enhanced auditory function they have. Uh, Typically, the biggest concern is relative to cognition. And typically, that cognition does not develop well. And as such, the language, although the kids are very verbal, tends to be very concrete and not very abstract language. Academically, traditionally, most of the kids do not do particularly well. But we have found that if we can start working with children with Williams syndrome early on and really work at developing all their neurodevelopmental pieces, that we can develop the processing skills, the short-term memory, working memory, executive function, and as such produce good cognition. We fortunately have had children with Williams syndrome who we have, if you will, graduated from our program, often at fairly young ages. Graduation essentially means the children are functioning normally for their chronological age to functioning actually well or above many of their peers for their chronological age. This is possible to do. It certainly is a lot more possible if we can start with the children when they are young and start building a strong foundation and move them on neurodevelopmentally at a rapid rate. One of the things that traditionally happens with these kids who are not given a lot of very specific input, particularly for the cognition, is they neurodevelopmentally get stuck at kind of the equivalent of where a lot of kids are cognitively at 4 years of age, which is when there's kind of a lot of imaginary play. The kids have nightmares, the kids develop phobias. Um, if we don't push that cognition and don't move the kids along well and fast enough and far enough, many of them get stuck at that level, and it's difficult to move them beyond that. But that really is only a reflection of lack of opportunity. It's not saying, this is going to be, this has to be. It's a matter of opportunity. And in truth, with virtually all of these kids, often the biggest limiting factor is the perception of potential. And if you will, typically the perception of potential is based on historic failure with children with Williams syndrome. And historic failure is based on very, very limited opportunity. People didn't know what to do. People's perception was the child's going to be very limited. So they didn't expect, to push cognition. They didn't plan to teach reading and math. And, rather than what we do, which is start working on those things early, so we give the kids a jump start on academics and cognition. everything is traditionally slowed down to such a slow pace that the development doesn't occur. But because it hasn't historically occurred, certainly doesn't mean that it can't occur. And you need to be very, very proactive. If we want to enhance the function, optimize the function, we need to optimize the opportunities. So it all comes down really to understanding the children as unique individuals. And it's very important we understand they are unique individuals. The fact that they have Williams syndrome, isn't a whole lot more significant than the genetic makeup of most anybody else. I mean, you see typical and the range of typical. There can also be the range here, and most of that, in terms of potential and ultimate function, is a reflection of opportunity. So working with these individuals, working with these children, number one, you perceive them as being unique. Number two, you perceive them as having unlimited potential. And number three, you provide them with all the opportunities you possibly can to help maximize their function and assist them in achieving that innate potential that they have. Thanks.